Good afternoon, everyone. I'm John Donvan. I'm a contributor at The Atlantic. Today is Thursday, March 26th, 2020, and we all know what we're here to discuss because we are all living through it. But I want to say this about the way we at The Atlantic have been covering this crisis. It was a month ago that we published a piece by Atlantic staff writer Dr. James Hamblin, and the title of that article was, "You're likely to get the coronavirus." And a month ago, that seemed like an unthinkable, radical concept. But now here we are. Since then, the virus has become the focus of much of the work being put out by reporters at The Atlantic, as they are working to bring you the most up-to-date and the most accurate information about the pandemic. And this conversation, this event right now, is a continuation of that coverage. So here's where things stand as of the top of the hour just now. Across the country, 196 million people are basically being urged to stay home. This is happening so far in 21 states, in 37 counties, and 16 cities. And in many of these places, schools and non-essential businesses have closed, and basically the economy is grinding to a halt. Of course, this is all in an attempt to slow the spread of the virus and flatten the curve, and thereby prevent a situation in which the healthcare system, the hospitals, are hit by a surge of sick people that they just would not be prepared to handle, with terrible consequences. That's the goal. In the meantime, the Senate, as of last night, has passed a $2.2 trillion economic relief package. The House is expected to vote on that package today. Shortly, we'll be talking with a member of the House of Representatives about the status of that work. Also, we are hearing the president throughout expressing his frustration about the country's economic shutdown. President Trump has said he would like to see the country back to business by Easter. That's April 12th. That's about 17 days away from now. At the same time, we are hearing pushback on that idea from many, including epidemiologists, other healthcare specialists, but also some top Republicans across the nation who are saying that the priority needs to be put right now on stopping the spread of the virus as opposed to reopening the country for business. And clearly, those two things are in tension, and we'll be discussing a little bit of that. But first, I want to welcome to the program Congresswoman Abigail Spanberger. She is a representative from she represents Virginia's 7th Congressional District. She is a Democrat, 10 counties in the center of the state. And Representative, thanks so much for joining us.
Thanks for having me, John. I appreciate the opportunity to join.
So one thing I want to get straight is where you are. You're obviously not in the Capitol. I'm guessing you're at home?
That's right. I am at my house right now. We released, after we voted on the second relief package, we all headed back to our districts for our what was a pre-planned district week, district work week. Of course, much of the work I was supposed to be out and about across the district, and much of that we canceled because of public health concerns. So I am coming to you live from my home.
So talk to me about this bill that the Senate passed and that's now in front of you. Do you expect that it's going to pass? Are there continuing barriers?
So as of right now, the trajectory for this bill, it has broad bipartisan support. You saw the Senate come through with an astoundingly bipartisan measure or vote count. This is similar to what we saw with relief package number 1 and number 2, both of which originated in the House. In those bills, we negotiated bills that were overwhelmingly bipartisan, and they passed with that level. This third package that the Senate has already passed is expected. We will be, the anticipated plan is that it will pass by voice vote because many of our members are unable to head up to Washington to vote. There are a number of us who do plan to be there to be among those who cast a voice vote, but that is really determined based on whether or not one can get there safely.
So you're in Virginia, not that far from DC. You plan to get there for it.
That's right. That's right.
And why is the voice vote important?
I think it's important that we as members have the opportunity to express our support of this bill, this overwhelmingly bipartisan bill as we saw it in the Senate. But a recorded vote where each member would have to vote individually doesn't seem from a public health standpoint that's an immediate possibility. We have many members who are in fact themselves either quarantined or unfortunately sick with COVID-19. So this is an alternate option that will allow us to cast that vote and pass this bill quickly.
And do you see this bill? I mean, it's so enormous, historically enormous. Do you see this being it for a while in terms of these kinds of responses, or are we likely to be back to the drawing board?
You know, John, I think it's a moving target. I think that, you know, the first bill relief package that we passed, I think it was about 3 weeks ago at this point, was focused on investments in vaccines, emergency dollars to our localities, so that they can adjust to the impact on communities. The second bill that we passed in the House at this point, I think 2 weeks ago, or on the 13th, it was focused on emergency sick leave for workers, ensuring food security for our kids who are out of school. And so now this next step is addressing the further needs that continue to be obvious of the American workforce. It's direct payment to individuals. It is increasing employment insurance, both in terms of who is eligible for unemployment insurance and actual payouts. It has significant benefits available, including forgivable loans, which for me was a tremendous priority for our small businesses that have shuttered across the country. And it provides federal assistance to larger employers so that they can maintain their workforce. So we are going step by step, kind of addressing the needs as it bubbles up with this crisis. And I have seen already in our district, as schools closed in Virginia initially just for 2 weeks and now for the remainder of the school year, I represent 10 counties, 7 of them are primarily rural, and I have counties where more than 30% of the children have no access to internet in their homes because there is no access to internet in the portion of the county where they live. So I think long range, this is certainly demonstrating where there are infrastructure needs that would be beneficial to our ability, either the educational piece or the telehealth related focus. You know, so much of what we're seeing is, please, if you can call in and talk to a healthcare provider about what your symptoms may be and avoid going into a hospital in the event that you do have this virus. For those who don't have telehealth options with the ability to connect to the internet at home, that's raising an issue. But I honestly think that, you know, what I'm talking about right now is much further down the road. Where are there places where we can get ahead of future challenges like the one that is presenting us now with this crisis?
And when you say that it is a moving target, what is the core variable? Is the unpredictability of the virus, or the
from my perspective, the core piece of it is, where do we need to focus our attention? And I think the primary piece that you have seen members of the Congress on the House side and the Senate side focusing their attention and aligned with, you know, I know you're speaking with Governor Hogan. I think this is similar for many states across the country at their state level, is the immediacy of the public health challenge. What do our healthcare providers need? What do our nurses and doctors need? How do we stop this pandemic? How do we invest in research to create a vaccine for this virus? How do we potentially find medicines that can help treat this virus? And then the immediacy of the impact across Virginia. Our restaurants are closed unless they are open for takeout and takeout alone. Our small businesses, with the exception of some essential businesses, have closed completely. That doesn't make that rent go away. That doesn't make the monthly payments that it takes to keep that business in existence go away. And so our focus at this point with this relief package is on the workers and on the structure of our economy that we need to be in existence when we get through this public health crisis.
The president says he wants the country to be open by Easter, 17, 18 days away from now. Is that realistic? Do you see that happening?
So my priority in all of this is listening to the experts. It's listening to the scientists and the physicians who are talking about what our healthcare system can handle, are talking about what we need to do to flatten this curve. Flattening the curve is not just about ensuring fewer people become infected with this virus. It is about ensuring that fewer people are infected at the same time so that we are not overwhelming a healthcare system that cannot handle an influx of patients.
So but Easter would be too soon for that, the experts are saying.
I mean, the experts are saying that with a resounding voice, a unified voice, that Easter is too soon. Here in Virginia, our schools are closed through the end of the year, and I think that we shouldn't be making promises to the American people that we cannot keep, or promises that would endanger their health.
We've asked people who are listening in and watching this program to send in some questions. I just want to turn to one of them. As of today, and by the way, anybody else out there, just use the chat function to send in a question for the representative. As of today, 3.2 million Americans have filed for unemployment related to the virus. In light of what's happening to our economy and to ordinary working people, how did Democratic proposals to add additional taxpayer subsidies for the Kennedy Center, new regulations for airline fuel standards, new nationwide diversity bias training requirements? This is a question that's based on the elements of the House version, a House version of the bill, that were picked out by Senator McConnell as having nothing to do with the immediate emergency, and was.
And I'm happy to answer that one, John. That it has nothing to do with the emergent need of this crisis. It does nothing to help people pay for their food on the table, put food on the table, or keep a roof over their head. And I was, as a Democrat, very adamant about the fact that our response needs to be focused on the immediacy of this crisis, which is ensuring the basic ability of the American worker, American workforce to put food on the table, keep a roof over their head, and be prepared to re-enter the economy when this public health crisis is over. And it needs to be focused on addressing the public health crisis. There was a bill introduced in the House that was separate from the negotiations that were occurring in the Senate. I actually personally wrote an op-ed essentially denouncing some of the far-flung ideas that were not relevant to our efforts to address the immediacy of this crisis.
How does that happen at a time like this? Again, I understand you're saying that the bill that we're talking about now doesn't contain this stuff, but how does that happen in the middle of a crisis like this, that stuff would get layered into the legislation, proposed legislation?
And I think it is, you made an important point. The final bill that has been voted on in the Senate that the House will be voting on does not include any of this extraneous stuff. I think that's important to note. How it gets included in a bill introduced in the House, I can't speak to that because that's a question I would love to answer myself, actually, John.
Okay. Something interesting happened just in terms of the workings of the legislature. Senator Rand Paul has tested positive for coronavirus. It raises a couple of questions. One is why he had access to a test. And I think a lot of people are curious. Do all of you in Congress have the ability to get tested? Do you have a fast track to that process?
So I can't speak to the actual circumstance of Senator Paul's testing. I have read, I haven't confirmed it in my capacity as a member of the House, that he actually had a test outside of the doctor's office in the House of Representatives. I do know that I was told, because my office inquired about testing options, I was told that there were not tests available. And this would have been as of the 13th or 14th of March. So for a time, there were not tests available to members of Congress who needed them. And it was my understanding that members of Congress who thought they might have had been exposed or were feeling symptoms were supposed to go outside of the Capitol. But I myself haven't been tested and haven't pursued that avenue, so I can't speak to that 100%. But at a time, about 13th or 14th of March, it was my understanding that there were no tests available for us either. Right.
Were you personally in close contact with anybody who's tested positive, as far as you know? I mean, within the legislature?
Yeah, within the risk time frame. One of the members who's test positive is a good friend of mine, and I see him frequently. What they gave us as the parameters is kind of continued exposure for 15 minutes or more in a certain close proximity within a certain period of time. And so I didn't meet that threshold where I would be overly concerned that I may have been exposed, at least by one of the individuals who's already tested positive.
So how can it work going forward for the Senate and the House to social distance on the one hand, and do business on the other? Congress literally means coming together. Yeah. How's that going to work? Has that even been addressed yet?
So it's something we're working through. The past week, again, last week, everyone was back in their districts. That was pre-planned outside of the pandemic. But it certainly gave us an immediacy of need to jump into how is it that we continue the function of Congress from afar. And I think I would note that there's a couple elements to the job that we do. We have a significant job back home in our districts. Typically, it's going out and visiting locations and talking with businesses and community groups. So that has been switched to the phone. Knowing that I'm somewhat close as I'm having conference calls with mayors and board of supervisor members and school board members and small business owners, rather than doing those meetings in person, I've been doing them on telephone conferences. Also back home in the district, we're delivering for constituents. We've had constituents who've been stuck on cruise lines or outside the country trying to get back home. We've been able to help them. And so that basic function has continued relatively seamlessly. Though our caseload in the area of trying to repatriate has of course gone up with this pandemic. Those two elements of the job have continued in a relatively seamlessly, though I would prefer of course to do in-person meetings with individuals. It's the focus on the legislation and the negotiation and frankly, the next step, which is getting back to doing committee work, where we are in our committee hearings, we are hammering out questions. It remains to be seen how we're going to adjust in the coming weeks in that space. We have had constant conference calls with our committees. I serve on the Agriculture Committee and the Foreign Affairs Committee. Both of those committees, we've had conference calls to discuss the impact of agriculture in the space of food insecurity issues, foreign affairs on the issue of repatriating American citizens trying to get back home. The Democratic Caucus has held multiple conference calls working through discussions related to this relief package. And then there's the mechanics of voting. So this is a constant discussion topic within Congress of how do we move to, in the emergency circumstance that is a public health crisis that requires that we not have hundreds of people in a small space, how do we adjust to that? And that's still a point of discussion. It's a point of debate as to how it is that we. Do
you have any ideas on that?
So I think that, for me, one of the easiest things we can do is we don't necessarily have to worry about hacking. We don't have to worry about the security of how it is we transmit a vote because our votes are all public. So we could do something as low tech as making a phone call where they maybe leave votes up for 24 hours. You make your phone call, your vote pops up online, and then you can confirm that in fact it's registered the way that you would want it to register. We could do something as low tech as that. We could do something as low tech as FaceTime to the parliamentarians so they see our face, or we could do something as high tech as install the sort of voting machines that require the specific cards that we utilize on the House floor. And I think anywhere in between is a space where we could resolve this issue relatively quickly.
You were talking about the rural challenge, and one of our viewers wants to go deeper on that. Tristan Shields asked, what is being done to address rural areas, both in the healthcare system and broadband internet? As you mentioned, you said that there are kids at home now who don't have broadband, right. and then just the challenges. It's an interesting situation, I think. You would imagine that in more rural areas, social distancing is built in, but maybe that's too simplistic. So what's your assessment of the challenge for rural areas?
Well, and I was reviewing the numbers. We have the numbers in terms of COVID-19 cases across Virginia, and notably and not surprisingly, there are fewer cases in our rural communities. People live farther apart, and in a time of social distancing during a public health crisis, that is beneficial. Where it becomes a challenge is in our rural communities, everything from access to information that one might otherwise get on the internet. If you don't have internet access at home, that's a challenge. If your child needs to suddenly finish out the school year using internet information, that's a challenge. For our school districts that have kids with a mix of access and a complete lack of access, they are struggling with what sort of schoolwork to deliver to those students. One of the things that I have advocated for is pushing for an FCC waiver to allow that our school districts can ensure hotspots for kids across rural communities. So, in a community where someone may not have the ability to install internet in their home, our schools are still wired. So can we ensure that they can use more internet accessibility to ensure that kids who Now, granted, they'd have to be able to get to those hotspots to use them and potentially safely remain in their car, but is that a first step towards allowing some level of access? I think that's something that so many of us have been talking about in Congress for quite some time, which is accessibility to what has become basic infrastructure now in the form of broadband internet, is clearly demonstrating, this pandemic is clearly demonstrating the actual need. So that's one thing, is removing restrictions on schools to allow them to serve as a hotspot location, and that's something that I have been working on, and I have a number of colleagues who have joined me in that effort.
Drew asks this question: why doesn't the federal government shut everything down for 2 weeks to stop the transmission instead of drawing out the process? It would be better for the people in the economy to lock down for 2 weeks.
Yeah. You know, this would be a decision that the administration would be the one tasked to make. I don't know why they...
Yeah, if you had the ear of the president on this, then he would do it.
I mean, if I had the ear of the president 2 weeks ago, I would have said, let's get aggressive on what we shut down, and let's utilize the Defense Production Act to begin the increase production of the personal protective equipment, and later down the line, the ventilators that we are going to need across this country. And so if I had the ear of the president, I would have advocated for aggressive measures at the beginning, which is what many physicians and researchers were advocating for. And I would have advocated for the implementation and usage of the Defense Production Act early. Now, it's not too late. We can still do it, and the president still should. In fact, I joined with 6 other Democrats and 7 Republicans to introduce a resolution on Monday to push the president, the administration, to utilize the Defense Production Act and to begin what is going to be a long path towards supplying the personal protective equipment and other supplies like the reagents and the nasopharyngeal swabs that our communities need to actually test for this virus.
One of the things that you've been talking about for some time, actually a number of weeks now, is for people who want to sign up for Affordable Health Care Act insurance, yes, that you want to set up a new opportunity for people who aren't signed up. So talk about, for anybody landing from Mars who doesn't understand what that's about, talk us through that.
Well, so typically anyone who would be interested in signing up for a marketplace provided plan would need to wait for the marketplace to open up, which is once a year unless you have a change of life circumstance, a loss of a job, a birth of a child, a marriage, something along those lines. And so what I have been advocating for is allowing, and this is an administrative change that Secretary of Health and Human Services Azar could make in a relatively straightforward way, to allow individuals who are currently not insured, who could purchase a marketplace, an ACA plan, to actually do so. Recognizing that there might be increased health risks, someone who might have chosen not to get health insurance because he or she thought that they were healthy and they didn't need it and they wanted to forego the expense, recognizing that they could have a life-changing, potentially fatal illness just any day now, allowing them the chance to buy health insurance right now out of the normal pattern when that is an option once a year.
And where are we on that option becoming possible?
It hasn't happened yet.
You think the odds are small?
I mean, I think it makes sense when we look at the stress that will be on our healthcare system. You know, hospitals are going to provide care. Our safety net hospitals are going to provide care to people across this country. When you look at the numbers of on the trajectory, who is going to receive, who is potentially going to contract this virus, there is every economic benefit to our communities to have more people covered by health insurance. And allowing people who would make that decision to get an ACA plan, a marketplace plan now, is vitally, vitally important.
Congresswoman, I want to thank you so much for joining us. And as we're all saying to each other these days, please stay safe.
Thank you. You too. Thank you for having me on.
It's a pleasure. And I want to thank everybody who's joined us for this conversation. It's a very busy Thursday. We all have a lot going on, so thank you for taking the time. I want to reiterate that the Atlantic is we're really on top of this and have been for several weeks, reporting it in a very deep way. It's all about keeping safe. It's all about getting the accurate information. Just go to Atlantic.com for that. By the way, we've made are essential coverage free. That's coming out from behind the paywall. So even if you're not a subscriber, that information is available to you. We're going to have more events like this one coming up. So please keep an eye out for those. Thank you again for watching us. I'm John Donvan.